When we think about cancer risks, lifestyle choices like smoking or diet often come to mind. We know that smoking can lead to lung cancer, and poor dietary habits can increase the risk of various types of cancer, including colon and breast cancer. These are well-documented and widely recognized risk factors that have been the focus of public health campaigns for years. But what about the age we begin having sex? This is a topic that is less frequently discussed in the context of cancer prevention, yet it is equally important. Early sexual activity is often overlooked when considering long-term health risks, but recent research is shedding light on its significance. A new study has revealed a surprising and concerning link between early sexual activity and an increased risk of cervical cancer. The study, conducted by a team of medical researchers, analyzed data from thousands of women and found that those who began having sex at a younger age were more likely to develop cervical cancer later in life. This connection is thought to be related to the increased likelihood of contracting human papillomavirus, HPV, a major cause of cervical cancer at a younger age. This discovery is particularly alarming because it highlights a hidden danger that young people need to be aware of. Many teenagers and young adults may not fully understand the long-term consequences of their sexual choices. The risk of cervical cancer is not something that typically comes to mind when thinking about the immediate concerns of sexual activity, such as pregnancy or sexually transmitted infections, STIs. It underscores the importance of open conversations about sexual health and the potential long-term consequences of choices made early in life. Parents, educators, and healthcare providers need to engage in honest and informative discussions with young people about the risks associated with early sexual activity. Comprehensive sexual education programs that include information about HPV and the importance of regular screenings, such as pap smears, can play a crucial role in reducing the risk of cervical cancer. By raising awareness and promoting healthy sexual behaviors, we can help protect the next generation from this preventable disease. Cervical cancer is a serious health concern affecting women worldwide. It is one of the most common cancers in women, and its impact is felt across all age groups and demographics. Early detection and treatment are crucial in managing this disease effectively. Regular medical checkups and consultations with healthcare professionals can make a significant difference in outcomes. This type of cancer develops in the cells of the cervix, the lower part of the uterus that connects to the vagina. The cervix plays a vital role in the female reproductive system, acting as a gateway between the uterus and the vagina. Understanding the anatomy of the cervix is essential for recognizing the signs and symptoms of cervical cancer. Medical professionals use various tools and models to explain the structure and function of the cervix to patients, helping them understand the importance of regular screenings. A leading cause of cervical cancer is the human papillomavirus, or HPV, a common sexually transmitted infection. HPV is highly prevalent, with many people contracting it at some point in their lives. There are over 100 different strains of HPV, but only a few are known to cause cervical cancer. Public health campaigns and educational programs aim to raise awareness about HPV and its link to cervical cancer, emphasizing the importance of vaccination and safe sexual practices. While many strains of HPV are harmless, some can lead to cellular changes in the cervix that, if left undetected and untreated, can progress to cancer. Regular cervical cancer screenings, such as pap smears and HPV tests, are essential for early detection. These procedures allow medical professionals to identify abnormal cells before they develop into cancer. Reviewing test results with a healthcare provider can provide valuable insights into one's health status and necessary next steps. Early intervention can significantly reduce the risk of cervical cancer, making regular screenings a critical component of women's health care. A recent study conducted in China has sent ripples through the medical community with its groundbreaking findings. This comprehensive research has delved into the intricate relationship between the age at which women first engage in sexual intercourse and their subsequent health outcomes, particularly focusing on the risk of developing cervical cancer. The research, which meticulously followed a large cohort of women over several years, has unveiled some startling correlations. By tracking these women and collecting extensive data on their health and sexual history, the researchers were able to draw significant conclusions. The study revealed a strong correlation between the age at which women first engaged in sexual intercourse and their risk of developing cervical cancer later in life. This finding has profound implications for public health policies and preventive measures. What makes this study particularly concerning is the magnitude of the risk increase. The data indicates that the younger a woman is when she first becomes sexually active, the higher her risk of developing cervical cancer. This is not just a minor increase. The study found that for each year younger than 18 that a woman became sexually active, her risk of cervical cancer rose by almost 1%. This significant increase in risk underscores the importance of sexual education and early intervention. The implications of these findings are far-reaching. Health professionals and educators must take these results into account when designing programs aimed at reducing the incidence of cervical cancer. By understanding the factors that contribute to the development of this disease, we can better equip young women with the knowledge and resources they need to make informed decisions about their sexual health. This study serves as a crucial reminder of the importance of early education and preventive measures in combating cervical cancer. In light of these findings, it is essential to promote comprehensive sexual education that emphasizes the risks associated with early sexual activity. By providing young women with accurate information and access to preventive healthcare services, we can help reduce the incidence of cervical cancer and improve overall health outcomes. This study from China is a pivotal step in understanding the complex interplay between sexual behavior and long-term health, and it highlights the need for continued research and public health initiatives in this area. The heightened vulnerability of young women to cervical cancer stems from a combination of biological and behavioral factors. During adolescence and the early 20s, the cells of the cervix are still developing and maturing. This makes them more susceptible to damage from HPV infection, potentially leading to cancerous changes. Furthermore, younger individuals may be less likely to receive the HPV vaccine or undergo regular cervical cancer screenings, further increasing their risk. The China study's findings provide compelling evidence for the protective benefits of delaying sexual activity until adulthood. By waiting until the cervix is fully mature, young women can significantly reduce their risk of HPV infection and subsequent cervical cancer development. Moreover, as young adults, they are more likely to have access to and utilize preventative measures like the HPV vaccine and regular screenings. These findings underscore the critical need for comprehensive sexual and reproductive health education for young people. Open and honest conversations about the risks associated with early sexual activity, including the increased risk of cervical cancer, are paramount. Equipping young people with knowledge empowers them to make informed decisions about their sexual health and well-being. Equally important is ensuring that all young people have access to essential preventative measures, like the HPV vaccine and cervical cancer screenings. Removing financial barriers, increasing awareness, and making these services readily available through schools and community health centers can significantly reduce the incidence of cervical cancer in future generations. The link between early sexual activity and cervical cancer risk should serve as a wake-up call for healthcare providers, educators, and policymakers alike. Prioritizing comprehensive sexual and reproductive health education and ensuring equitable access to preventative services are essential steps in protecting the health and well-being of young people. By working together, we can empower future generations to make informed choices and live healthier lives. Sarah was a vibrant 24-year-old woman when she received the devastating diagnosis of cervical cancer. She had been sexually active since she was 15 and, like many young people, was unaware of the risks associated with early sexual activity. Sarah's story is a poignant reminder of the importance of early education and prevention. By sharing her experience, she hopes to raise awareness and encourage other young people to prioritize their sexual health.